name na Kona Sise. Today we can work at the Ministry of Information and Communication, the weekly press briefing where they can normally call the members of the 4th Estate for. Today we dey go inside the conference room now as we dey go witness the press briefing.
As usual, we'd like to begin this press briefing with the weekly updates, and that will be followed by introduction of our key speakers chaired by the Deputy Minister of Information and Communication. We begin with the update. Parliament yesterday debated and approved a $55 million grant for the construction of a fish harbor at Black Johnson. Members of Parliament unanimously approved the grant and cautioned the Honorable Minister of Fisheries and Marine Resources to take into cognizance all social and environmental preventive measures from the operational area and the community. The Minister of Fisheries and Marine Resources, Honorable Emma Kuwajalo, stated that the construction of a fish harbor will bring sanity to the fishing sector and it will greatly contribute to the country's GDP. The United Nations Partnership on the Rights of Persons with Disability country team, in collaboration with the Ministry of Social Welfare, has ended a 5-day induction workshop on at Family Kingdom Resort that was aimed at issues that borders on the rights of persons with disability in the country. The Honorable Minister, Madam Bendu Dasama Kamara, disclosed that the workshop was a joint expression of interest in outlining issues of persons with disability, as it was a joint expression that presented a huge opportunity to persons with disability, which is an integral component of the United Nations global response to developmental issues. The Minister of Technical and Higher Education, Professor Alpha T. Wuri, has held discussions with the administrative staff and students of Jala University at the university's auditorium, Jala campus. His engagement was aimed at entreating the administration to heighten its staff capacity and quality of outputs, with much premium on the core sciences for which the university was originally created, as well as presenting teaching and learning materials for the university. Sierra Leone's Minister of Planning and Economic Development, Dr. Francis Kai, has in a virtual meeting informed the annual investment meeting organized by the United Arab Emirates, UAE, that Sierra Leone is an enabling environment and a reliable destination for investment. With the theme, Africa Unlocked, Innovation and Sustainability as Drivers of Economic Growth, the 2-day virtual conference seeks to explore the developmental potential of the African continent and highlight its huge opportunities that can serve as key sources of economic progress, not only for the region, but for the world. And lastly, the Director General of Human Resource Management Office, Mr. Ansu Samuel Toka, has concluded his administrative tour in 3 districts, including Falaba, Kwenadugu, and Karine. Civil servants in the 3 districts have described the Director General as a visionary and committed authority who is determined to transform the Sierra Leone civil service as an effective and efficient service delivery entity. The outreach was established as a direct line of communication with civil servants nationwide, with a view to educating them on the ongoing reforms and efforts of government of Sierra Leone in improving service delivery, identify the challenges civil servants are faced with in discharging their duties, and to enable the HRMO to find solutions to those challenges for improved service delivery. And that ends our update for this week. And for the rest of the briefing, we'll take you now through with the Deputy Minister of Information and Communications, Mr. Solomon Jamil, who will introduce the speakers present and discussions for today. Thank you very much.
Thank you, Mr. Toure, for forerunning this. I take the opportunity to welcome all of us and ask us, as our usual public health advisory, please fully mask up. Thank you. So we have with us today the distinguished Deputy Minister for Gender and Children's Affairs, Hindowa Bindi, as well as Frank Williams, the second in command for NaCOVERC Operations Pillar. And I'm sure he is doing so much of the heavy lifting in trying to enforce the measures as announced by His Excellency the President on 1st July. So he will be talking to us about the scope of operations as it is and some of the technological features that we're lending to the COVID-19 enforcement process. So we have these two distinguished gentlemen with us. I will do a joint presentation with Frank. I will do the forerunning with some basic data as to where we are. And after that, Frank Williams will talk to us about the scope of operations. But first, I wish to give the floor to my distinguished friend and brother, Hindowa Bindi, to Deputy Minister of Gender and Children's Affairs, to talk to us about Cluster 5 of the Medium-Term National Development Plan. And we know the Ministry is currently working on the Gender Empowerment Equality Bill, and which seems to be a very proactive step. But let me give the floor to our Deputy Minister to talk to us about Cluster 5 and any other issue he considers very material under the circumstances. Mr. Bindi.
Mr. Chairman, the Honorable Deputy Minister of Information and Communication, members of the Ministry of Information and Communication, the Director of Gender, Ministry of Gender and Children's Affairs, distinguished members of the First Estate, ladies and gentlemen, good afternoon. Like the Honorable Deputy Minister did say, who happens to be the chairman, so I'm here on behalf of the Ministry of Gender and Children's Affairs to come and give an update of the activities of the Ministry of Gender and Children's Affairs. It's going to be a PowerPoint presentation, and as you can see, the Ministry of Gender and Children's Affairs is tasked with the following. So lead the development, implementation, and monitoring of policy and legal framework of issues relating to women and children below 18 years of age. We lead on development and monitoring of policies related to gender and children's issues, take necessary actions to achieve full participation of women in development. We address issues of violence against women and children. We liaise with development agencies, NGOs, who are addressing the needs of women and children. We collaborate with the relevant ministries, departments, and agencies working on gender and children's issues. That is why we are here today on a weekly press briefing with the Ministry of Information and Communication. We mobilize resources in support of gender and children-related projects. We also ensure that gender and children-responsive national development frameworks are being done across the board. Like every other ministry, in line with the new direction of His Excellency the President, Brigadier Retired Dr. Jesus Madabio, we have a vision as a ministry. Our vision is to have a society free from violence and discrimination, and where the fundamental rights of women and children are respected and cherished. The Ministry of Gender and Children's Affairs principally provides leadership for Cluster 5 of empowering women and children, as indicated in 5.1 and 2, respectively. And in that very cluster we're talking about, there are two policies and objectives. 5.1, to promote the overall empowerment of women in political, social, and cultural spheres. 5.2, to ensure a child-first approach for survival, protection, and development of children including disabled and vulnerable children, prioritizing the best interest of children at all times. With special focuses, we launched one more. Okay, 5.2, like I was saying, to ensure a child-first approach for survival, protection, development of children, including disabled and vulnerable children. We're prioritizing the best interests of the child at all times, with special focuses addressing sexual violence, teenage pregnancy, child marriage, orphan and vulnerable children, child trafficking, child labor, and juvenile justice. Results. The government of Sierra Leone has revised and strengthened the Sexual Offences Act of 2012, and now the Sexual Offences Act amended 2019, with robust penalties and operational mechanisms put in place for implementation, including but not limited to medical examination, treatment and reports. We have set up the 116 hotline on sexual gender-based violence, setting up of 6 one-stop centers in Kiama Road Hospital, Boloka, Koinadogu, Kailahun, Moyamba, and Pujan districts. The establishment of the sexual offences model court within the judiciary, amongst others. All these measures are put in place to provide holistic service and fast-tracking justice delivery system. The Child Rights Act of 2007, it's currently under review as approved by Cabinet. The process is expected to be concluded before the end of this year. It will, among other things, address harmonization of age marriage, expand harmful practices to include female genital mutilations, those are FGM, amongst others. The Adoption Act of 1989. The Adoption Act of 1989 has been revised in 2010, but was not conclusive. Upon the division of the Ministry of Gender and Children's Affairs from its parent Ministry of Social Welfare, the ministry and its partners are now at advanced stage to reviewing the enactment of the Gender Bill of 2021, and which is expected to be concluded also by this end of the year. It will incorporate also the Hague Convention and other best practices when it talks about adoption across the board. As a ministry, of course, its name depicts itself, the Ministry of Gender and Children's Affairs. We are dealing with the Gender Equality and Women's Empowerment Bill of 2021. Our ministry and its partners are at advanced stage in development of the Gender Bill, Equality Bill. This bill will include political empowerment, both appointive and elective, economic empowerment through across the finance, especially on credit, empowerment among others. Once Cabinet approves this bill, the due process will be followed on it to be tabled in Parliament for an enactment. This will make a huge shift in the empowerment of women and men in Sierra Leone. It is expected to be concluded before the end of this year. We also have the Gender Equality and Women's Empowerment Policy. The government of Sierra Leone has adopted one of the progressive policies for the promotion of gender equality and empowerment of women around the world. The policy was officially launched by His Excellency the President, Brigadier Retired Dr. Jesus Madam Diop, on the 3rd of December 2020 for its full implementation. The policy has been rolled out across the country and copies disseminated to all stakeholders for implementation. The ministry further organized National Women's Conference to share policies and develop a work plan for its implementation. The slides will go very faster because these are the activities that we are undertaking by the ministry, the International Women's Day, when we launched the entrepreneurship, financial literacy training of the Beawa project beneficiaries Sierra Leone. I think we'll come to this project later because this was a project that was done in Bo District and which had over 200 women beneficiaries. But along the line, we'll come to it. Let's go, please. You can see it was at an occasion and a one-stop center. Yes, this one is, remember once I was doing my presentation, I spoke about the one-stop center, wherein when sexually gender-based violence incidents are taking place for treatment, you can see the team of MOGCA handing over materials to the manager in Kailan, one of our one-stop centers. The strategies of our ministry. As you all know, the Ministry of Gender and Children's Affairs, the National Male Involvement Strategy for Sexual Gender-Based Violence Prevention 2020, the SGVV, the Ministry of Gender and Children's Affairs in collaboration with partners developed the strategy to address sexual gender-based violence and was officially launched by His Excellency the President, again on the International Day of Women on the 8th of March 2020 in Cambia. Our national strategy also for SGV Response 2021, I beg your pardon. The ministry has finalized a draft of the strategy and ready for printing and dissemination in the shortest possible time. Our Street Child Strategy 2021, which is also very, very much paramount to the ministry. Our Honorable Minister, she's very, very much passionate about this because when we talk about children, we are not just limiting ourselves to school-going kids. But when you say street children, of course, His Excellency the President also is very, very much passionate when you talk about children, street children. So we have designed, we're working on the policy at that level, which is the National Street Children's Strategy, which the ministry has finalized draft of the strategy and ready for printing and dissemination within the shortest possible time. Plans as a ministry, in line with the medium-term plan of the government of Sierra Leone, we're working on the National Gender Strategy Plan for 2019 to 2023. The government has developed the National Gender Strategy Plan that's aligned to the mid-term National Development Plan. With the establishment of the Ministry of Gender and Children's Affairs, we are currently working on the development of the strategic plan for the entire ministry that will cover gender and children's affairs. You know, our government and other development partners have signed other MOUs at other various levels. So at this stage, we are looking at the Sierra Leone National Action Plan for the United Nations Security Council Resolution 1325 and 1820. Sierra Leone as a member to the UN, as part of its Security Council Resolution, the United Nations Security Council Resolution 1325 on women, peace and security was adopted in 2020, and its sister resolution in 1820 on sexual violence in 2008. Member states were encouraged to develop national action plan for its implementation. Sierra Leone developed its first national plan in 2010, and the plan elapsed in 2014. The government has developed the second generation of the National Action Plan from 2019 to 2023. Thus, in the crafting process, which promotes a culture of ownership and sustainability, which include based in one country. Demands and priorities, the matters of prosecution of perpetrators of violence against women, community engagement and coordination, undoubtedly, the agreed pillar of SleepNap 2 will go a long way in addressing violence against women and ensuring inclusive participation and empowerment for women. We're also talking about the National Referral Protocol on Gender gender-based violence 2012. The National Referral Protocol on Gender-Based Violence is currently undergoing review to include school-related gender-based violence. We are collaborating with the Ministry of Basic and Senior Secondary School Education on this particular one. The women's empowerment, which is also another key pillar to us as a ministry. The Women's Empowerment Fund for Female Entrepreneurs, the ministry has developed concept notes on the Women's Empowerment Fund, which has been submitted to the Ministry of Finance through the Ministry of Economic and Development Planning for funding. The government of Sierra Leone, with support from the Spanish aid, NEPAD, through ECOWAS, has concluded the implementation of the pilot project called the Business Incubator for Africa and Women's Entrepreneurship, BAWA, which earlier I spoke of, in Bo District, covering 6 chiefdoms in that district, with 200 beneficiaries. Ladies and gentlemen, Mr. Chairman, the Honorable Deputy Minister of Information and Communication, the Director, this presentation is a PowerPoint presentation. I am here with the Director of Gender. We're here to explain to the country, the general people, what the Ministry of Gender and Children's Affairs has been doing over the period. And we're here available for questions on twofold. So when it comes on policies, we at the leadership level, I'll be here. And when it comes to the technical aspect of it, I'm here with Director Charles Vandy. He is also willing and available. On that note, before I ascend this assembly team, so Chairman, I want to say thank you very much for coming and giving us an audience as a ministry. To the press, we are always open up as a ministry because we believe the issues of gender and children's affairs, they are cross-cutting issues, and the state, His Excellency the President, is very much interested in them, and we are ready to move that right into a new trajectory. Thank you very much.
Thank you very, very much, Mr. Boakai Bindi Hindowa, Deputy Minister, Social Welfare, Gender and Children's Affairs. And I also wish to acknowledge the presence of your Director of Gender, Mr. Charles Vandy. Thank you for such a comprehensive presentation, which I am sure gives all of us an idea of the progressive legislative steps taken by the Ministry for Gender and Children's Affairs. We believe, as an administration, that issues relating to women and children should be an integral part of our development thought processes, and that is exactly what informed the formulation of Cluster 5 in the Medium-Term National Development Plan. We believe as a country, as the distinguished Deputy Minister has said, we are catching up. We are catching up to make sure that we domesticate key international protocols like the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention on the Rights of the Child. All of those ones, once they are domesticated, we make sure that those ones will provide sufficient legislative and policy cover for issues relating to our children and our women. In countries like Rwanda, the Deputy Minister will tell you, they have a constitution 2003, which was revised in 2015. In their own constitution, in fact, they provided for minimum 30% representation for women. So for them, it's in the constitution. Here we are trying to do affirmative action to make sure that even though somebody was asking, say, if we get a country who said the woman then boku pass man, you see now they help the woman then back forget 30%. All they need to do is to just come together and bully us the men. So thank you very, very much. So let me at this point, before I bring in Frank Williams to give a few cumulative confirmed positive cases for COVID-19 as of yesterday stood at 5,867. The epicenter of this pandemic continues to be the Western area. Urban is accounting for 59% of the confirmed cases since March last year, followed by Western area rural with 16.3%, And then you have Kenema District with 2.9%, Potloko 2.6%, Bo 2.4%, and Bond 2%. So we have confirmed cases, 5,867 as at yesterday. Our total deaths stand at 108, and we are aware we recorded 31 cases yesterday. In terms of the accumulation for the past 7 days and the previous 7 days, so for the past 7 days, we have recorded a total of 292 cases, which we may wish to compare with 523 in the previous 7 days. So the previous 7 days, 523, the last 7 days, 292. So we have seen a 44% decrease in cases for the previous 7 days and the current 7 days, last 7 days. So 13 out of the 16 districts have recorded cases in the last 7 days. And as I said, from the 31 cases we recorded yesterday, they actually came from Western area urban, Western area rural, Potloko, Moyamba, Kenema, and Kailaon districts. That's the 31 cases for yesterday. So for the last 7 days, 13 districts out of 16 have actually recorded cases. In terms of the treatment centers and care centers, current bed occupancy stands at 46%. So 46% of the current bed capacity is actually utilized. And I say current bed capacity because we're aware before the scaling down of the response, which actually meant in terms of bed capacity, we reduced some beds in some treatment centers and care centers because the case numbers were low then. So when I say bed capacity, it's actually in terms of the current bed capacity that we're using, which is around 488 or thereabout. So 46% of those beds are occupied in treatment centers and care centers. We continue to celebrate our health workers, to say big thank you to them, because even health workers in the course of addressing COVID-19 pandemic have also been infected. In fact, 4.4% of the cumulative confirmed cases is actually accounted for by health workers. So they also continue to suffer from this. Let's continue to have them in our prayers and in our best wishes. Vaccination is continuing all over the country. Government is making very frantic efforts to make sure that we augment the current stock that we have. Necessarily because the quantity for AstraZeneca was lower than the quantity for Sinopharm. It's not surprising that we seem to be having challenges. That number has depleted considerably. We only have few stock left for AstraZeneca, and for the few that we have, government's intention is to prioritize persons with underlying medical condition. So that explains why perhaps some people would go to some vaccination center to receive vaccination. If you're going for your first dose, that may be delayed a bit, and priority will be given to those who are supposed to take their second dose, and also persons with underlying medical condition. We still have a good number of Sinopharm vaccines which we continue to administer, and we want to continue to reiterate to the general public that these vaccines that are being rolled out have satisfied safety and efficacy requirements. They are validated by the World Health Organization. They were given emergency use authorization, and our pharmacy board, having looked at the clinical trials as well and the literature available, they believe that these vaccines are safe and they are effective for the purpose of administration. So we continue to count on you as our friends in the media and civil society to continue to diffuse the negative messaging around this, to please help us to address the misinformation and disinformation around this, and to ask our people to come out and be vaccinated. We would have learned, I'm sure we are now privy to the CDC risk assessment level 4 for about 54 countries as at yesterday, including Sierra Leone. And they are asking citizens of America who wish to travel to Sierra Leone to reconsider their travel and make sure they are fully vaccinated before they could come to Sierra Leone. The context is we are in the third wave. We are also having Delta variant. We have been very forthright with the public about how lethal and how intensive the third wave is and the Delta variant. We have spoken a lot about exponential rise in cases. We have spoken a lot about positivity rates, about increased hospitalization. 2 or 3 days ago, I did an interview on BBC where I also spoke about 70 to 80% of the beds at 34 and Adra Hospital occupied. So as a nation, we have been very forthright and transparent with the people of Sierra Leone. So when some of us were informed about the level 4 classification for Sierra Leone, in as much as we are concerned as a country because this would have implication for travels, but again, given the context and that it's not only Sierra Leone that is in this, we have quite a good number of countries who are currently classified under level 4. So we have countries like Sweden, Netherlands, UAE, Seychelles, even Rwanda, South Africa, Uganda, Liberia. Some of those countries fall under the 54 countries as at the 6th that are now under the level 4 classification. So what is level 4 classification? This is pretty much the classification for United Kingdom as well. So the first layer they would look at is what they call COVID-19 unknown. And they call that category COVID-19 unknown because some countries may not seem to be putting out sufficient data in the fight against coronavirus. So if you don't get statistics or you don't actually have a sense of the COVID-19 situation in that particular country, they would wish to classify it as a COVID-19 unknown. After that, you have level 1. Level 1 is when you say the COVID-19 situation in that country is low. And then you have level 2. Level 2 is when you have a sense that the COVID-19 situation in that country is moderate. And then you have level 3. Level 3 is when you say the COVID-19 situation is high. And level 4 is when you say the COVID-19 situation is very high. What that means is, advising your citizens, you may wish to say, okay, that particular country is level 1. So please exercise normal precautions if you are traveling to that country. For level 2, it means take increased caution if you are traveling to that country. Level 3, you are saying to your citizens, you may wish to reconsider your travel. And level 4, you are saying, please don't travel unless your travel is essential. If you wish to travel, make sure you are fully vaccinated. So if you look at the Centers for Disease Control and Prevention advisory for US, they are saying if you wish to travel to Sierra Leone, make sure you are fully vaccinated. And if you look at the third wave and the Delta variant, for a country like US, which has vaccinated in total 48 to 50% of their population, but for the adult population, they have vaccinated, I think, over 60% of the population. President Biden's ambition was to have vaccinated about 70% by July 4. That ambition has not been met, but they have vaccinated quite a good number of their people. UK has vaccinated also over 60% of their adults. EU generally, vaccination stands at around 25-30%. Africa is yet to go beyond 3% of vaccination. So this explains when people look at this situation, and this is why, again, I'm very passionate about this. We have to really work hard to call on our people to get vaccinated and diffuse any negative rumors, any negative messaging, misinformation and disinformation. Because this is Africa's struggle. If we are not careful, vaccination will become one of the important tools in diplomacy. And for countries like us, which are at the receiving end, will always suffer the brunt of some of these diplomatic endeavors. So let us, in our own endeavors as well, let's make sure we vaccinate and get our people also to come out and be vaccinated. Our business as a country is to make sure that we become extra vigilant and make sure that we comply with the measures. We are required to mask up fully, wash our hands with soap and clean water, or if you have the alcohol-based sanitizer, use it. We social distance, or we do physical distancing, but let's get vaccinated. That is important for all of us. I gave us the data for the previous 7 days, 523, which reduced to 292 in the last 7 days, which shows a significant decrease of 44%, which means the measures have the potential to work if we comply. Once we continue to abide by the measures, we'll continue to see decrease in the numbers, and that should be able to inform those who are placing us on whatever levels to reconsider that position. Let me bring in Frank to talk to us about the scope of enforcement, and then we'll get questions from the press. Frank.
Thank you very much, Mr. Chairman. Good afternoon, all. Kindly permit me to do this short talk on existing protocols. Our job as enforcers for the regulations becomes easier when we get high cooperation from the public. It is very difficult when there are challenges from the public. To make our job easier, we have decided to go a little bit electronics. With the current situation, which is the curfew order that is in place, we have established an electronic system wherein the public can apply to get passes through the electronic system, and of course the portal is, or the link is, if we are interested, we can record this link. It's epass, one word, .covid19.com. epass.covid19.com. These passes will be issued to essential service workers, those who know that are supposed to be on the streets. We issue to them. What we did in that direction, again, we have whitelisted some institutions or essential service workers. They know exactly the vehicles that are supposed to ply the streets during curfew, and they have the liberty to issue those passes to the vehicle. We have increased the checkpoints within Freetown and the country at large with increased personnel deployed at those places. I must hasten to say that these personnel have checker phones. They'll use those checker phones to ascertain the validity of your passcode. If you're not supposed to be out, they'll keep you, you'll spend the night with them, and maybe they'll release you in the morning. There are also night patrols to ensure we reduce the presence of people on the street. Night watch checkpoints are up and running. We are also issuing security clearance for funerals, weddings, and other social events, with a specific caveat to it, provided you are ready to keep your audience to 50. We are monitoring the access of persons to public buildings with the availability of vaccine cards. We may not be everywhere at the same time because we have schedules through which we work. We rely wholly and solely on the media to help take the message to the general public. Once more, I want to thank you all.
Inside the Ministry of Information and Communication, the weekly press briefing today, we get the Deputy Minister of Information and Communication, Wena Solomon Jamiu, and we also get members that will come out from NaCOVERC, and also we also get the Deputy Minister of Gender and Children's Affairs, where they come talk about the things that where the ministry don't they do over the years, and also talk about plans where the ministry gets for picking them where they're in the streets and them when are less vulnerable picking them. We also listen from the Deputy Minister of Information and Communication as he give in weekly reports, and he also talk about the thing that we NaCOVERC don dey do so far for help fight the COVID-19 sick. He also send message to the 4th estate that them for help, for send information to people out there where they afraid the COVID-19 vaccine, and for tell them say not to think for afraid, but then encourage people for take the COVID-19 vaccine. We will bring the program come to you today. My name is Nakona Sise. Until we meet again to another edition, I say tata.